Start then. Today we try Zoom instead of direct go to webinar or Facebook Live. So this is our third meeting. Again, we are always telling you why we are doing this. Actually, we are testing some ways of communicating with our patients and with others out there who may be interested in what we are doing and how we are managing the situation today. Today is August 7th, 2020. I have my group, my team is supporting us for this. I'm going to share some of the updates for coronavirus related stuff, and then some of the patient related items that it may be helpful for you guys to follow. So I'll start with some updates. This is from USA Today. The coronavirus updates with the US death prediction actually is about 300,000 with the first 7-year-old being youngest victim. So this is something that I thought it would be important for us to share with you in case you are not getting these updates from the regular news you are getting. So this 300,000 is, they are talking about the prediction of December 1, 2020. So what I do with these, I'm going to share my other screen. Tanner, I'm just going to make sure that you are confirming because this is the new Zoom. So are you on you are seeing the screen rather than PowerPoint?
It's on a little bit of a delay.
Okay, so once we confirm that.
Just give me a couple seconds.
Is PowerPoint still on then?
We're in your browser now, you're good.
Okay, so we checked the numbers from Worldometer. So it does help you with the prediction as well as the number of tests and everything else. So when you look at the total number of cases as of this minute, it does give you where we are, but this is constantly being updated throughout the day. And then if you want to see the entire numbers from yesterday, that's at 58,600, and 2 days ago number is also here, and that's at 55,000. Now, if you go to the specific country, in this case in United States, we can see the projections and the predictions of these. Now, the way that would be by going to the projections, and then you can actually see these graphs. These are all available. There are other websites who are doing these. It's more about like once you get more comfortable with one, you kind of keep using the same. So if you were looking just for the projection, then we would be looking at this number. Now today is 7th. As you can see, there is a little bit delay for the confirmed cases, and that is coming from as those numbers not being confirmed. So whatever the number we have daily, that's not actually yet completed for those days. There's about 7 days delay. Now from here, you can actually see the daily number of deaths, and then you can see the projection of this. And I think the number for December is taking these its numbers from here. So if I were to take the if I just leave this for the projection, so December 1st right now, this is on that specific date. It doesn't give me the total. I thought it does, but in November, I mean the end of November, it's going to be anywhere from 1,800 to 3,400. So then now from here, I'm going to go back to my updates on daily numbers. Now, as we were talking about these things not being a potential threat for the kids, that's not true, because there is the first case of the youngest victim of COVID-19 did happen in Georgia, and as the schools are opening, we may have more problems with this population. So we do want to take this very carefully. We want to make our decisions very carefully. Okay, so this is, I thought it was maybe a little bit funny, but maybe it's not, because apparently some people are doing this. So please don't drink hand sanitizers. You can clean your hands, but not drink them. Don't drink them. So apparently 4 people died or something like that. I mean, this was in the news. So now what I want to actually share for our patients, something more patient specific, we are looking at this opportunity to connect with our patients, and then we can get more information out there. One of the problems from our central office from United Medical side is the way that our patients are trying to reach us. So you may be reaching us for several different things, but mainly for billing inquiries, or it may be some other stuff. And in today's setup, for you to call us on the phone, it's not going to be most ideal, because we have only so many people who can answer the phone at the same time. But the best would be is going to the patient inquiry and putting one there, and then actually we can reach out to you at the best time that would be for you. So we do want our patients to utilize this. So how you can find this is it's on United Medical website. So I'm going to open that. So here is, if you go to the United Medical website, and you can find this on your on statements as well. So when you receive the patient statements, so but this information is right. This link is available right here under the patient inquiries. Now, if you please use your patient portal, all the links actually are going to be on your homepage. But if you are not, then you can still find this from the from our website. So then this is the live part of the portal. What you can do here is, if you would like to receive a confirmation email, so you can choose that option. In that case, you need to tell us what you are calling us for. Let's say the most common one is insurance info update, let's say. Then you need to provide us some information. You need to tell us who you are, how we can reach out to you, what's the best number to reach out to you, and then what's the best time to contact you, your email, and then your physician name or the practice name, you can put it here. We are, I would say 95% of the time, we are back in 24 hours, but it can be, since these are not urgent reach, we may be up to 48 hours, but at least you'll be reaching out to us without waiting on the phone, being on hold for 20 minutes. This would be a really good way for you to reach out. Now, we also, from here, what I would like to also share is, and I really do want our patients to use these. If I'm going to come back to the IQ Health, but if we can also use the patient survey. I personally send patient surveys from our system. Well, I say personally, but I maybe lied a little bit. So actually, our system is automated so that it generates those surveys. Tanner from our office manages them. So you may be receiving a survey with my name on the bottom. So we do want you to actually please fill out those surveys. So you reach out to us, so communicate with us, so then how we can do better, how we can improve. And I'm going to actually just show you from the live site to see what that setup is. So on our patient portal, so before, so there is here, no, this one here. So I opened it earlier. So this is on your patient portal website on the default homepage. So you can do this in Spanish, para español. So, and I don't speak Spanish, so then I'm not going to do that. But if you do, you can. So your name, your facility are the ones that we are managing this. These are facilities here available. And then the provider name, you can type that, your date last visit, And these are the certain areas that we want you to rate us, and so that we can actually improve accessibility, communication, care coordination, staff, facility, and overall satisfaction. Now, I'll take you to a live, I mean, this is live, but I'm not signed in, but I'm going to actually just show you something from the signed part of the patient portal. So let's take this out here. So bring it back here. Okay. Now, this is directly under my name here. I won't, of course, give you any patient data, but I'm going to just share what our statistics, where our statistics are. So for United Medical ACO, we are looking at our total numbers. And then I believe the industry standard for outpatient practices is, if I'm going to double check that for you, but it should be 85%. I'm sorry, it's 75%. So we'll make sure that by next week we'll get you a new number, and then we can put that in the description here. So we are at 94.1% out of 356 surveys were answered, and then 21 of our patients, they didn't recommend our services. However, 94.1%, 335 out of 356 is positive, and this number for the industry is 75%. So we are extremely proud of this. Now, although we love this number, we love our surgery center numbers even better. Our surgery center is American Surgery Center, and we do a similar survey, and American Surgery Center is one of the only bariatric center of excellence outpatient surgery center in Delaware, and it has several certifications in the specific area, Blue Distinction and Aetna quality programs for bariatric. We are one of first. There are only 14 surgery centers with the MBSA QIP, which is the certification for bariatric for surgery centers, and we are one of those. I believe we are the 15th when we got that last year. So from that setup, our satisfaction rate is 99.2%. Only one patient did not recommend our services out of 127 surveys. This number could have been higher, this 127, and because we didn't do any cases in the month of last week of March and entire April and early part of May, the total number is slightly lower, but we do normally get about 20% responses from all surgeries, and we are extremely proud of this number. And then, so national benchmark for patient satisfaction for this group is 86%, so we are at 99.2%. So, all right, let's go back to our PowerPoint again. So one of the really important part of what we want our patients to do in today's medicine, the landscape of medicine, what patient can do. We do a lot of telehealth, telemedicine. That means we want our patients to be ready with the equipment that they need, their phone, smartphones or their laptops, whichever setting, but we definitely want these on a video. We are supporting the video visits when we say telemedicine and telehealth. In some cases, the emergencies where they're not full emergency, but they can be handled and then you don't have access, we may do audio, but that's not what we are supporting. We want our telehealth and telemedicine to be conducted through a video call. So this is extremely important. Part of that, what we need from you is the IQ Health, which is our patient portal. So this should be given to you at the time of your appointment. So you should activate that. This empowers you in so many different ways, enables you to communicate with us with a lot of it's just expedites everything. So I'm gonna actually find our YouTube video. I don't think there's any harm to play the what you can do with this portal. So I will play that one very quickly. So this is okay, and videos. All right, so.
Are you ready to take control of your health and your time? With the IQ Health Patient Portal, you can access all your important health information anytime and anywhere from your smartphone, tablet, or desktop computer. Send and receive messages to and from your providers. View your test results. Request medication refills. Request an appointment. And update your demographic information. Download the Healthy Life app to your smartphone or tablet for convenient access to your IQ Health Patient Portal on the go today.
All right, so Tanner, I remember we have a longer video of this, so I don't know where that.
Are you ready to take?
Okay, I'm not going to play it again, but so. Yeah, I think we have 3 minutes of that. I'm going to actually just check if the United Medical has, maybe if we have it on United Medical website, the homepage. The United Medical, here we are. Okay. So let's see. So we have our telemedicine. Okay. No, that's actually the same one. That's only okay. I'm gonna actually play since we are doing this. Let's play the telemedicine and see what that says.
United Medical Clinic is proud to announce we are offering the options of telemedicine visits for our patients. Our providers are ready to use Doxy.me to help provide the healthcare you need from the comfort of your own home. Telemedicine is a web-based application, so no app or download is necessary. Telemedicine visits can be set up by calling the provider's office or setting up an appointment through the IQ Health Portal. Once the appointment is set, make sure you have a device with a webcam and a microphone ready. Devices such as laptops, computers, and phones will work perfectly fine. When the appointment arrives, your doctor will provide you with a unique custom link that you will want to enter into the web browser. Enter your name to check in, then your doctor will know you're ready to be seen. Once checked in, a button for enabling camera will pop up. Allow the device to enable the camera so you and your doctor can see each other.
Oh,
you will then be put in a virtual waiting room where the doctor can see you are ready for your appointment. Once the doctor is ready to see you, they will simply click on your name and your telemed visit will begin. We thank you for entrusting us with your care. Stay safe and stay healthy. Thanks for listening.
All right, so that's good. Now, we all, under United Medical, we also have our nutrition and diabetes, and the from our behavioral health program, we have some videos available. So from the, especially these days when the access is kind of limited and it's more on the remote, please take advantage of these. And then my team actually is putting a lot of time to bring these videos up. Now, one other thing, there are a couple other things that I do want to share, and let me just make sure that from different activities that we do, from our American Surgery Center for the Bariatric, from the Bariatric Program, and CRIAS, our Bariatric Surgery Office, we have 2 events every week. On Tuesdays at 7 p.m., Dr. Erkan, he goes live with Facebook Live, which will, I'm sure, now we are trying the Zoom today, and then we'll be able to have more than one person on the screen. So we were kind of struggling with the technical difficulties. And I think we solved that problem. So we are going to actually start hosting these on the Zoom setting. And Dr. Erkan has been doing this for a while now with Facebook Live, and his next event is on August 11th. These are extremely beneficial and efficient discussions that we have around bariatric surgery, morbid obesity, and how we can help those patients. And also we have, every Thursday, we have a webinar that is rotating between different doctors. Last night, Dr. Singh was on, and he did in the last 2 weeks, actually. But then we have Dr. Wynn, Dr. Peters, Dr. Ibrahim, they are doing their cases. So their sessions with us, this is mainly to help you. Now, the other thing that I do want to bring up here is we have a new support group, a new page. I do want to share that one with you. So this is under United Medical UMACO Wellness Support Group, which actually is just going to be UMACO Wellness Program. We set up a new group there. It is for our patients with diabetes. And then that is going to be managed by our one of our dietitians. We have 3 of them, as you may know. Amy Wilkinson is the one who's managing this group. Their first event actually is coming up. That's why I want to mention this. And we set that up. So we were doing this on our own without anyone's support. So Tanner wasn't available when we were doing it. So it's going to be, details will be listed on this, but we are going to have our first one on August 19th. This is specific to patients with diabetes. And our, as I mentioned, our dietitian will be there. And also the following week of I think August 26th, we are going to have Dr. Ripu Handal. He's an endocrinologist in Delaware, and he's going to be, he's the program director of our diabetes program, and he's going to be with us. And then we'll start having more routine events on a regular schedule, and then we'll try different things to make sure that everyone is able to attend in different times and different days. But we are going to start this as of August 19th. The first event is going to be at 7 p.m. Now, we are looking for some feedback from our patients who are watching these, or who may, and we are going to post the live videos, of course, but the diabetes group, support group, is a private group, and it needs to be, when we post it, it's going to be only for those group members. The videos will be available later on, but if the 7 p.m. is not the ideal time for most people, we are picking and choosing these based on what would be the best time. So like right now I'm doing this at noon, and maybe 30% of you would say, well, this would be better if it was after hours, but then 50% says during the day is better. 70% says maybe it's a weekend better. So we'll be looking into those and then make sure that we can make some changes based on what the majority wants. We also have our new support group under our surgery center. And why am I not able to see the page here? Sorry about that. Okay, for the surgery center, we have the group also now live with, it's a bariatric support group this is for our bariatric patients. This one mainly is going to focus on patients after bariatric. So this is going to be available for those patients who may want to be part of those discussions. So that's what we have from the social media side. And let me see what else I prepared for you guys. So we discussed those, we have that, we have this. we did cover. You may want to check this out later. I did give you the numbers from today. But again, what's really interesting is where we were as of April 15th and then as of May 15th, and then looking at these numbers next to each other is going to give you a different take on what's happening today. If you really think about the total number of people as of April 15th, 56,000 versus now it's 3 times more. And then now they are saying that this is going to be about 300,000 in the next 3 months. It's pretty scary. So I am going to stop here. Now I should mention our, I mean, in case you didn't catch these on the first 2 meetings, United Medical ACO is very close to managing our orders for COVID-19 test, and then this is our way of looking at it. And then when the numbers went down in June with total numbers, we encourage our physicians to put more orders out there so we can test more people. Now, speaking of that, actually, one I do want to mention, and I don't want to be all over the place, but it is important. So when we look at the Worldometer website, one interesting part that I see is if you live in Delaware, you may find this interesting, maybe where we are in terms of what we are doing. In Delaware, we are, so this number is really important, the test in 1 million. So United States average is at 190,000. So 190,000 in 1 million people were tested. So if you look at that and then see where Delaware is, we are only slightly over that average. Now, I think I did work with Governor Carney in the past. I haven't talked to him for a while, but if he's watching, or if he does watch this sometime later, he really needs to pay attention to this. So Delaware is, we are easily able to manage this. So meaning that, so just kind of give you a little Zoom number here. So Delaware is, from a small state standpoint, this number being only slightly over the average, United States average, is not so great. So we should be able to test more people. Not sure how much emphasis that's being made on that, but this is not something that we can say that we are in a good position, because the fall is coming. Well, winter is going to also come, so the fall is coming. So you do want to actually pay attention to this number. And I would, I have been reaching out to Governor Carney's office. Not sure, they have not reached out to us in our management of Corona, and then we are doing everything pretty much on our own. But I would definitely encourage them to work on this number. That number is small. So as you can see, like Rhode Island, isn't it Rhode Island the small states? So they are at 373,000, which is twice more. So John Carney, get your act together and then do this. So let's bring us to this level. So being small should have some advantages, and this would be one where we can manage the population in a better way. So, and you can see the other states here. This is a very useful website. I do use it every day for our meetings. We are, let me see if I think since now we are able to do this in the Zoom setting, we are gonna have, for next week, I will probably start with Jackie. So it will be on the screen at the same time. So that's what we were trying to figure out for a while. So now we are able to. So hopefully next week, my guest will be our social worker, Jackie. And then she'll talk to us about the psychological effect of the COVID-19. She's doing this with our providers and providing a service for our patients. But I think what she's able to share is going to be very helpful for everyone. So that's what I would like to tell you. So I'm not going to spoil that now. So, and that's what we have all together from our side. So this is again something that we want this to be part of our business culture, to reach out to the society directly and then our patients, for them to directly hear. Some may find this interesting. If you don't find it interesting, don't watch it, no problem. But if you do and if you have time, please follow us. We'll be reaching out to you with more videos in the future. All right, thank you.